Welcome back to familydoctor.expert. Today we're talking about the embarrassing subject of erectile dysfunction. Now often the guys are embarrassed to bring this up with their doctor. They come in saying, I'm just here for a general checkup or for some other trivial matter, and then they finally mention, usually when they're just about to leave, that they're having erection trouble. So it's sort of embarrassing. It's actually very common. Over 40, about 1 in 5 guys have got some sort of erection troubles, and probably 1 in 10 are getting no erections at all, so it is very common. Of course, it's normal sometimes to not get erections. Might be to do with being tired, alcohol use, stress and worry can have a big impact. And I've got to say, when the guys come in with erection problems, they're really quite stressed about it. It influences their whole sense of identity. So we take it seriously. So apart from some of the normal variation of erections, there are some people that really are struggling to get a proper erection where they can have sexual activity. So the technical definition is inability to keep an erection that allows sexual activity with penetration. So what sort of things can cause problems? Actually, an erection is quite a feat of physiology. When you look at the neurological and blood flow, and everything's just got to happen at the right order. So first of all, looking at the blood flow, any cardiovascular problems, particularly diabetes or high cholesterol, high blood pressure, smoking or obesity, any of these things that affect blood flow can affect the erections. More than that, having erection problems can actually be a sign to us that there are cardiovascular problems brewing, and it is associated with increased rates of heart attacks and strokes and things like that. So your doctor will take it seriously. But that's not the only cause of erection troubles. Sometimes it's hormonal, particularly some men have low testosterone and your doctor will check that. Sometimes there's a problem with the nerves, either a spinal cord problem or Parkinson's disease or Alzheimer's disease. Sometimes there's a structural problem with the penis. There can be sort of some thickening of the scar tissue called Peyronie's disease, or if someone's had an injury to the penis. The other big group that we see are people who are on medications. The 3 big groups that cause problems are the antidepressants, the anti-cholesterol tablets, and also the blood pressure tablets. So we'll have a look at those as well. Surgery for the prostate is another problem. Even though the prostate isn't specifically involved with erections, very often after prostate surgery men can have problems with erections. So there's obviously the psychological causes in some men, relationship problems. Very often it can be just situational. So particularly some of the young healthy guys who come in and are having erection troubles, they've usually had a bad experience and they've sort of lost their confidence in a way. And the problem is that they get an erection and then their brain goes into overdrive and they set off what we call the autonomic or sympathetic nervous system, and pretty much the erection goes away before they can have sexual activity. And so sometimes we need to have a talk with them about how they're thinking about things. So what will your doctor do? So if you mention it to your doctor, they may well want to examine you and just check that there's no injury or obvious sort of physical problem going on. They may well want to do a blood test looking for all those cardiovascular things I talked about, for diabetes, for cholesterol troubles. They'll check your blood pressure. They may want to do blood tests for thyroid disease, to look at your liver. If you've been drinking a lot of alcohol, that can cause a problem with erections, and the doctor will pick that up on the liver test as well. They may want to measure testosterone levels and see if they're low. And there's a bunch of other things that they may want to check for. Now there are a bunch of fancy sort of ultrasounds and blood flow tests and things, but generally they're organised by urologists. They sometimes do what's called a nocturnal penile tumescence test, where they have a look if you're having erections overnight. And actually knowing if you're getting any erections helps tell the doctor whether or not there's actually some structural problem or something else going on. So fortunately we've got some excellent treatments to help, particularly the oral medications. and their technical name, they're called PDE5 inhibitors. And you will have heard of the trade names, I'm sure, Viagra, Cialis, Levitra, and they've got chemical names as well. Now, there are potential side effects with all these medications. You need to be really careful if you've had heart disease, particularly if you're on these medications called nitrate medications, because they can combine with these medications and really have a dangerous drop in blood pressure. There are other common side effects involving facial flushing or headaches or visual problems. But I advise you, if you're going to take any of these, as with all these familydoctor.expert videos, double check the product information. Don't rely on this video as your only source of information. But it gives you a little bit of a sense about those medications. Generally, you take them an hour or so before sexual activity. One of them, Cialis, they recommend that some men can take it as a low dose every day, and that sort of allows a bit more spontaneity for sexual activity. So, another group of medications are the injections, and most people cringe when you say you're going to actually inject the penis. Although I've got a few patients who use the prostaglandin injections, and there's a few other sorts, and they're actually quite satisfied with it. They use it about 5 minutes before they want to have sex. The erection can last for an hour or so. There's a couple of potential side effects there. To use it, you have to go and get supervision, usually from a nurse, to show you how to use the injections. You have to be careful of a complication called priapism, which is like a long-lasting, painful erection that can permanently damage the penis. If testosterone is low, your doctor might suggest some testosterone replacement. There are other treatments. There's some herbal treatments around, but a lot of those don't have a lot of clinical trials yet. Some patients seem to think they're quite helpful, but we don't really have all the scientific evidence out on those yet. And then there's some other things that men can do. There's a vacuum pump if men are struggling to get the erection in the first place, or if the problem is maintaining the erection, there's rubber rings that they can use. More extreme interventions, surgery involving penile implants is another option. So, we're lucky in a sense that there are many things that men can do. It's an embarrassing but very common problem. Importantly, having erection problems might be a sign that you've got some other medical conditions going on, so it's a really good time to have a full checkup with your doctor. So I hope that this has given you the general lie of the land about erectile dysfunction, and I wish you well from familydoctor.expert.